Good morning, everyone, and welcome back to our updates from the DSA. As you know, we started these updates during the height of the COVID-19 pandemic, and we were bringing you all the latest information about COVID-19 and the implications for people who have Down syndrome. We're back, and we probably won't be doing the updates weekly, but we'll be sending out information to you as and when we have something really important to tell you. Not surprisingly, we are being asked to do something by way of further information debate about the Down syndrome bill, and we fully intend to do something in the coming weeks. And obviously we will be advertising that widely amongst our members, and we will come back to you when we have something to report on that. So very soon we'll have something about the Down syndrome bill. Okay, so today is International Day of Persons with a Disability, and the Our Voice team were asked by Cardiff University to produce a film. So here are some of the members of Our Voice with their creative pieces of work, which was the theme that they were asked to submit a film on. Okay, here we go with Our Voice.
Part of the DSA team, we work together for change. We are included in DSA's work. We tell the DSA when we think. We speak up for our rights. We work together to help other people who have Down syndrome. This is our video what we made.
Well, we hope you all have a wonderful day of celebration. Now, we are going to start with an update about WorkFit, and then DS Engage and DS Active, then our work with government, Our Voice, a little update on helpline training and support, and World Down Syndrome Day theme, and then one of our series of oral histories. We've got a little excerpt from Richard talking about his life with his sister, and then questions. So over to Simon.
Thank you, Jill. I'd like to give you just a little update from the Down Syndrome Association's employment program, the WorkFit program. Some may not know anything about WorkFit. So WorkFit is a tailored supported employment service which connects employers and employees who have Down syndrome. WorkFit began placing candidates across England and Wales in 2012. We have staff members covering all of England and Wales. So what have we been up to? Well, the last few months have probably been the busiest we've had on the WorkFit program. We've successfully brought back the vast majority of the furloughed WorkFit candidates that sadly were unable to work during the COVID-19 period. We're delighted that we brought back the vast majority of furloughed workers. WorkFit continues to generate employer interest across the country, with employer interest and registrations at record level. Large employers such as GXO, Dunelm and Greggs continue to place their trust in the professional service, specialist provision and dedicated employees of the WorkFit team. Delighted to say this, but over 90% of WorkFit placements during the last 6 months have been paid roles, and that's a wonderful stat there. Recent successes, WorkFit, we've been developing diverse roles in the banking sector with opportunities created at HSBC and Barclays. Our incredibly hard-working Employment Development Manager, Alison Thwaite, managed to secure a meeting with Chloe Smith, MP, the Minister for Disabled People, Work and Health at the London Hilton and Metropole. The Minister was able to see for herself the WorkFit candidates at work and the successful WorkFit model at work. You'll see Alison in the second picture alongside Chloe Smith. Alison's on the right-hand side. And we've got a short film coming up very shortly. Further employer WorkFit employer success at the 2021 BASE Awards. That's the British Association for Supported Employment. We've had long-running successes at these awards over the last 5 years, and 2021 was no different, with 2 employers receiving recognition for their work with WorkFit candidates. And I think this is a success because we've been after Roy Parrott for a while. Roy Parrott has joined the WorkFit team as the WorkFit Liaison Officer for the Swindon Down Syndrome Group. Roy is a wonderful addition to the team and brings a wealth of knowledge and experience. He worked for Wiltshire Police for almost 40 years and worked with our WorkFit candidates within Wiltshire Police. So he's obviously seen WorkFit on both sides, which is great news. Short film for you. This is Alison Thwaite at the Hilton Metropole.
Brogan, Shamari and Sam all have Down syndrome.
Yes, that'd be right. Thank you very much indeed.
Meeting the Minister for Disability today to be congratulated on their achievements.
Can I say hello? My name's Chloe.
Working at one of London's biggest hotels.
My name is Brogan. I'm working in the Hilton Hotel and I'm a chef and I like catering and I really prepare all the salads. It makes me happy and the staff is really nice.
My name is Shamari. I work here last Tuesday. I help with my team and to put the bags in the trolley, take it to the rooms. We've got big boxes there in the luggage room. The best thing I like helping my team because the team make things together.
I'm Sam. I like work in Hilton Hotel. It makes me happy. I could cucumber and I could lettuce. I just like work. Make me happy.
All earn the going rate for the job they're doing and have a buddy to supervise them.
Sam's been here about 4 years and Brogan's been here about 2 years, and they're just really a delight to work with. They kind of give them a task and they do it like exactly how you ask them to do it.
Even though this hotel is really big, we've got 1,006 rooms, we've got a lot of people here, but he takes his time, he talks to the guests nicely. That's what we want anyway.
The government's now calling on other firms to do more, to mirror the experience of these 3, so valued at this landmark London hotel. Guy Lynn, BBC London.
Well, I hope you enjoyed that. Our WorkFit candidates at work. WorkFit played their part at the World Down Syndrome Congress. The WorkFit team shared their experiences through a video and showcased WorkFit candidates and their colleagues working at GXO sites throughout the country. It also demonstrates the WorkFit process and the support that we offer to our employers and candidates when they're in placed positions. Tom, who works at GXO in Widnes, shared his experience of being a warehouse operative at the recycling centre. Tom has excelled in his position at GXO Widnes. He is a popular and highly regarded team member. He receives outstanding support from his buddies, who are passionate and committed. John, the site manager, said Tom is a great asset to this company. His work rate is good and his smile brings sunshine to the site. And I think you'll agree with that. That's Tom in the middle picture below. Thank you, Joe.
Thank you, Simon. Now to Kate.
Thanks, Jill. Good morning, everyone. It's lovely to be with you all and to give you an update on the DS Active programme and DS Engage this morning. So if we just start with DS Active, for those who don't know quickly, it's a programme to maximise the opportunities for children and adults who have Down syndrome to take part in sports and other physical activities. And since the last update, we've had a successful summer of tester sessions in cricket, football and sailing. As you can see there, everyone's having a great time making friends, cementing friendships, and Rosie and Ellen there are with their attendance certificates, very proudly showing them off. 65% of clubs, we're delighted to say, are back delivering face-to-face sessions. And we've also been able to continue with our DS Active Coach Education Workshop online. And we're also thrilled that 5 new sessions, club sessions, have been launched in England recently. Thanks, Jim. So looking forward to 2022, we are hoping that our festivals will grow in numbers. We have 4 regional football festivals planned for March and June. We have the South England Tennis Festival planned for April time, and then we're looking forward to the Sailing Festival in June. So we do love to hear about all the brilliant things you are doing to keep active, all the sporting activities you're taking part in. Please do keep sharing them with us, and please do consider filling in the photo permission on the Get Involved DSA webpage so that we are then able to share those stories with everyone else. So moving on to DS Engage, we are really delighted that the DS Engage programme has successfully continued post-lockdown restrictions, and the number of people joining and enjoying the sessions continues to grow week on week. The DS Engage programme is a programme of weekly regular live Zoom events, and there is at least one session that is live Monday to Friday each day. And the programme aims to provide something for everyone to keep themselves physically and mentally active. We do have additional special events, so please do take a look at our web pages to keep up to date with those. And we also have some great extra content on the DS Engage web page, and that regularly gets updated, and you also have an opportunity to look at the YouTube channel as well. This is the DS Engage timetable, handily all in one place for you to print out or save on your phone, take a picture of it. You'll see that the events are at various times of the day, so hopefully there's something to suit everyone. And our very popular discos run at 4 and 7 p.m. on alternate Tuesdays, and they really are lots of fun, and would thoroughly encourage you to join us if you haven't been to one of those. So looking at what we've been up to in the past few weeks, we've had a number of special events. Recently held a fantastic Halloween disco where you could really dress up as whatever you wanted, because it was all about having fun, enjoying company, having a dance, enjoying the music. As you can see from the picture there was really quite a wide range of ages that attended. And everyone is very welcome to attend these special disco events, which we do try and make a little bit more accessible for families by putting them on at earlier times. So then also we have other special events which have included some fantastic crafting events led by Donna. The clay courses and the ongoing Christmas art and craft sessions are very, very popular. And as you can see from these pictures, there are some very talented crafters out there, and the enjoyment starts, as you can see there with Amy, from the moment the box arrives right through to the time at which the product is that they've crafted is finished. We also had a very successful summer holiday fun with Down syndrome and a very popular work fit workshop during this time. So moving forward, of course, there are going to be special Christmas events available. I mentioned that the Art and Craft Fun has already started. It is a constantly evolving programme, so please do keep an eye on our webpage to see what's up and coming. Our upcoming regular 4 p.m. disco is going to have a Christmas theme. In fact, I think it's going to be Christmas Pictionary, which will be great fun. Really do recommend it. And even if it's just to see how brilliantly myself and Robin don't draw, it's worth a look. And therefore, your information as well, there was just a quick reminder that our last session will be on the 17th of December, and we'll be rejoining with the programme again on the 10th of January. So big news for us. We're absolutely thrilled to announce that we have a special Christmas event with Singing Hands, and it's going to be taking place a week on Monday, 5 till 6 p.m. So we hope that you, your friends, your family will all join us to get in the Christmas spirit. And this is now available to book on the DS Engage webpage. So we also on our webpage have some beautiful Christmas colouring pages. We have some very talented members of staff and trustees who have helped us create these pages. There's something for everyone. And again, we'd love to see how you complete these colouring pages. Please do send us in pictures of them to show us how talented you all are and the beautiful end results. And then looking forward to 2022, we are starting the year with a special event that is the Work Fit workshop. It is a rerun of the workshop in September. We're really lucky that WorkFit have found time to be able to provide this workshop again for us. So if you weren't able to make it in September, please do book on. And also, if you attend in September, but you just like a refresher or there are some questions you now have, please do feel free to book again. We look forward at DS Active and DS Engage to sharing further updates with you as we move into 2022. So please keep checking our web pages for those. Thanks, Jill.
Thank you, Kate. And now to Julian.
Morning, everybody. Really good to connect with you again. Such a lot has been happening really over the last month or two since our last update. So just a couple of pieces of information about engagement with government departments, NHS, Department of Health and Social Care, both in England, Wales and Northern Ireland. Really importantly, and this is something that came as a result of the pressures that we were all experiencing around COVID-19 back at the spring of last year, we began meeting monthly with the head of learning disability and neurodiversity at the Department of Health and Social Care in England, and those meetings continue. We have our next one next week, and they're really useful because they are an opportunity for government teams and the voluntary sector to sort of update each other and share experience. So it's really good that that carries on. People probably will have followed a lot in the news this week that on Wednesday, the government published its long-awaited social care white paper. And we were really pleased that a few hours before that press embargo was listed, we had a direct contact to Carol, asking her to join a network of chief executive officers that work in organisations supporting people who access social care, really to reflect the experiences and the needs of the people that we're here to support. So that's a really good opportunity that we're looking forward to exploring. And then in Wales, we meet quarterly with the Learning Disability Ministerial Advisory Group. So I go to those meetings. And back at the beginning of the autumn, we had an invitation to go and meet virtually with the newly appointed Chief Social Services Officer for Wales. And Kate, my colleague that you just heard speaking about DS Active and DS Engage, came to that meeting as she happens to be a parent and lives in Wales. And so she was able to reflect a bit on the experience that she knew of families locally in terms of their engagement with social services. And quite a big focus, ongoing focus on health issues. And we were really pleased a few weeks ago. I had a meeting on Tuesday of this week. Gillian and I went to meet with some newly appointed project managers that are working on a really sort of landmark, innovative project in England, where individuals who have a learning disability will have the option to have a digital flag attached to their shared medical record. So this will mean that anybody who has access to a medical record, whether that's NHS 111 or paramedics or your GP or a hospital consultant, would know instantly that the individual has a learning disability. And at the moment, that isn't in place. So it's something that we feel will be really helpful moving forward, because it will not only identify people that have a learning disability, but it would record any of the reasonable adjustments, you know, what would make interactions with a health professional easier for that person. And we're going to be working with that team and engaging with our voice members, because obviously the opinions and views of individuals who have Down syndrome are going to be key in this. So we're looking forward to working with them over the next couple of months. People are probably aware that there's been quite a lot of debate and talk about the introduction of mandatory learning disability awareness training for health and social care professionals. In England, that's called the Oliver McGowan learning disability training, and in Wales, it's called the Paul Ridd training. That's been slightly delayed because of COVID, because obviously NHS have had so many pressures over the last 18 months or so, but it is moving forward, and we've been part of a pilot looking at that training and looking at an evaluation of it. So we'll be able to report more on that over the next few months. And then we were pleased a couple of weeks ago to get a proactive approach from a health trust based in Northwest England, who are writing a learning disability strategy for their whole trust, and wanted to engage with us to make sure that that met, you know, the expectations and needs of people that we would be supporting. And also they were keen for us to discuss how we might be able to provide some training across their staff team. So that could be quite a big piece of work coming up in the spring. Consultations have been ongoing. There's quite a lot of consultations focused on the needs of adults who have more complex needs. We submitted a written response a few weeks ago to a NICE consultation on that. We also provided quite a bit of information. Helen, our welfare benefits advisor, was getting quite a lot of calls from families of young adults who were turning 18 and had had a child trust fund. And there was some concern that if an individual had a learning disability, that in order for that person or the person's family to access those funds, they would need to apply to the Court of Protection, because the individual might not have capacity to manage their own financial affairs. So that's been addressed, and we had fed back information to the Department of Work and Pensions about the difficulties that families are experiencing. And there is currently a survey being launched. It was launched this week and will run for another couple of weeks. So we put a news item about that on the website, and the link is there. So we would encourage families that might be in that situation to complete the survey. It doesn't take very long, and we will be submitting a written response based on the experience that we have of people contacting us. And then finally, in terms of consultations, as part of the disability strategy across the UK government, there's some work going on within the Department of Work and Pensions to try and simplify what is, you know, we know such a complex system for families who are applying for welfare benefits. So we submitted a written response to a consultation, and also pulled together a group of adults who have Down syndrome and their family carers to share their experience of applying for various welfare benefits over the last 12 months or so, and ministers and civil servants would have been able to hear at first hand how that situation could be improved. So we're really pleased to have had that opportunity. And then finally, obviously COVID is still dominating so much of our lives at the moment. And this is just a bit of a summary really, that and this should be information that you will be aware of, but just to clarify that anybody over the age of 16 who has Down syndrome should by now be eligible for their booster vaccination. So this is an additional dose. The interval has been reduced. So it initially was 6 months and then it was reduced to 5 months, but it now stands at 3 months. So if you're over the age of 16 and you had your second COVID vaccine more than 3 months ago, you are now eligible. So you don't need to have to wait, because there will be a process of moving through the age ranges now down to people over the age of 18 by January. If it's 3 months since you had your last vaccine, then you can access that now. Children who have Down syndrome were always eligible for 2 doses of the COVID vaccine. That's now been extended to all children in that age range, and those would be spaced 3 months apart. Just a reminder that in addition to COVID-19, there are seasonal flu vaccines, which it's very important that people access, and you can have those either at the same time, if that's a possibility in terms of the logistics of organising that. That is possible, or it might be 2 separate appointments, but do make sure that you've also had your flu vaccine. And then finally, really, in terms of advice to people who were previously identified as being clinically extremely vulnerable, that list has now been wound down because the eligibility of vaccines has been rolled out. So everybody that wanted to have a vaccine was prioritised, and the success of those vaccines have been pretty good. So the government feel they don't need to give any additional advice to people who have Down syndrome. So people with Down syndrome are subject to all the same advice, hands, face space, well ventilated indoor spaces. So it's still important to keep safe, but you don't need to do anything additional. So hopefully that's quite reassuring for people. And then I think the final slide for me is just a summary of where you can access the latest advice for depending on where you live. So England, Wales and Northern Ireland, and helpfully have different information, but you can just go on to those government websites and find out what is the latest information in terms of wearing face coverings and various other things for your country. And there's also some advice given to supported living settings. So if you have a loved one that lives in a supported living setting about going to visit them or having them out for visits home, there's guidance there that was updated about a week ago. So that's quite helpful to be able to go and visit that.
Thank you, Julian. Now we have an update from members of Our Voice about just some of the important work they've been doing.
The Our Voice team delivered a presentation at the World Down Syndrome Congress. Here are some clips.
Welcome to our presentation. We will be talking about working together at the Down Syndrome Association, England, Wales and Northern Ireland. We are your hosts, Lindsay, Joe and Sam. What is inclusive participation? Inclusive participation is about everyone being and taking part in the work and activities of organisations. It means everyone's voice is listened to and that decisions are made with people rather than for them.
Why do people who have Down syndrome take part in Our Voice? Jack says, I like communication and that we all respect everyone's choices. I quite like all of it. Good to meet other people. Brogan says, our voice is incredible and actually inclusive.
If you want to watch the whole presentation, the link is on our Facebook page. Thanks for watching.
A very big thank you to our voice, fantastic. And now moving on, just a reminder that our confidential helpline is open and busy every day, and that we have regular and training events and support meetings, and you can find those on the training page. So do keep an eye on the training pages in the website as new support meetings and events are added. Now I'm handing over to Sheila.
Hello everybody. For those of you that don't know me, I'm the fundraising and membership manager. So if you've got any queries on those two things, then do get in touch with me. I'm going to start off with Awareness Week, which we're all very excited about for next March. And I'm pleased to announce what the theme is, which is Inclusion Means. So we're all missing out if everyone isn't included. So we want to celebrate how inclusion improves life for all of us. And of course, we are desperate to hear from you guys about what inclusion means to you. So if you can see the link at the bottom of this slide, if you want to go there and tell us exactly what inclusion means for you, that would be fantastic. Obviously, the big theme of Awareness Week is also lots of socks, and we've got our stock of socks in early, everybody. And as you can see, they are electrifying with their lightning bolts. They're already on sale on our website, so you can get them in time for Christmas, so you can rock your socks on Christmas Day. We've also still got Christmas cards available, and it's not too late to buy them, so please do go onto our website and go into the shop and see what lots of lovely things we've got for you there. And finally, for those of you that are local to our beautiful building, LDC in Teddington, 21 & Co are putting on a Christmas Carol by Charles Dickens on the 17th and 18th of December. And it's going to be a real festive experience for everybody, and it will be just great if you can come along. The event is supporting both the Down Syndrome Association and 21 & Co. So if you can come along, please do.
Thank you, Sheila. And now I'm going to show a very short part of one of the series of our oral histories where we talk to people who are aged over 50. And here's a clip of Richard accompanied by his sister, Fiona.
My full name is Richard McGregor Morgans. I was born in Dublin.
I'm Fiona Morgans, and I'm Richard's sister. Richard is funny.
Yes.
And he's very caring, and he's very kind and very thoughtful.
Yes.
He's also very cheeky, and can be a lot of fun.
Yeah.
Lovely, thank you. And you can find all of those oral histories on our website, and you'll see the link there. Now that brings us to questions and the end, moving towards the end of this presentation. I'm looking, so do type in any questions if you have them now. I have some comments that I'll read out from Joe. He says, I would like to say a huge thank you to the entire DSA team for all the creative opportunities given to me throughout this past year alone, especially as it's now been literally a year since joining in the DSA for my first time ever. Thank you. Thank you, Joe. And another member has said how much her daughter Hashi has really enjoyed the Christmas art sessions. Thank you to everyone for setting these up. Okay. I'm waiting to see if there are any other questions. And yes, you know, a big thanks to every person who's a member of our voice, as well as a member of the Down Syndrome Association. Well, I can't see any further questions unless I've missed any. Oh, and we have another one from somebody who works for a dance company. It's a full-time professional dancer. And can they pass on the information about this to our communications team? Yes, you're welcome to do that. Yeah, email us and tell us more about that. Thank you. Okay, well, from all of us, thank you very much indeed. Remember to keep in touch and we hope to see you again soon. Thank you. Goodbye.